Do you have severe, unbearable, excruciating pain during menstrual periods? Does having sex feel like a nightmare to you? Is there pain even when there's an urge to pee or defecate? If yes, you may be suffering from endometriosis. What is endometriosis? What are its causes, presentations, and diagnosis? What are the treatment methods available? Can you get pregnant with endometriosis? We'll answer all of these questions today. Hello, I'm Dr. Sumayya Alansari, a senior consultant homeopath at Olive Homeopathy, Malappuram, Kerala. What exactly is endometriosis? For that, let's take a look at this model. This is a model of uterus. This is your uterus. There is a special kind of tissue in the inner layer of uterus, which is called as endometrium. Endometrium is the lining that sheds during your menstrual period. So endometriosis is the chronic condition in which a tissue similar to the tissue lining the inner side of the uterus starts growing outside the uterus. Yes, the bleeding part of the uterus, the bleeding tissue of the uterus is found elsewhere in the body, which also bleeds during menstrual period. So you see where that pain is coming from. It can affect females of any age, even teenagers. In fact, endometriosis can start at the first menstrual period or menarche and last until menopause. What are its causes? I wish I could tell you, but unfortunately, the fact is we do not know. Currently, we think that the likely source of this issue is occurring during the developmental stage of the fetus itself. So when the patient is developing as a baby inside the belly of the mother, we think that endometriosis starts from that point onwards. But we come to know about it later on when the menstruation starts, because just like the endometrial lining starts shedding blood during menstrual period, these tissues also starts shedding blood. How will you know you have endometriosis? Well, endometriosis is something that is a little bit elusive, but we can suspect it based on the signs and symptoms you are experiencing. So if you have pain in your pelvis in general and back pain, which is especially worse during menstrual periods, and then you have pain during sexual intercourse, urination, and bowel movements, all of this may point to a suspicion of endometriosis. But unfortunately, the only way to say 100% whether you do or do not suffer from endometriosis is through surgery. Because during surgery, you can remove the tissue, put it under a microscope, and definitively say whether you do or do not have endometriosis. Can endometriosis be detected on imaging? Unfortunately, most of the times, no. Because the vast majority of endometriosis is superficial. It's almost like paint spackling on the wall, which cannot be seen during imaging. There are exceptional cases though when these tissues start growing inside other organs in the pelvis or abdomen, like bowels or bladder. Such a situation is called as deep infiltrating endometriosis. Such deep infiltrating endometriosis can be detected on imaging like USG and MRI. Can I become pregnant if I suffer from endometriosis? Yes, absolutely. In vast majority of cases of endometriosis, you can conceive and have children. Although there are certain cases where patients suffering from endometriosis also suffer from other kinds of diseases which causes infertility. But in most of the cases, they are not only able to conceive, achieve pregnancy, continue normal pregnancy, but also deliver a healthy baby. If I have endometriosis, do I need to do hysterectomy? No, not necessarily. Since here uterus itself is not the problem. The problem lies elsewhere, and in hysterectomy you remove uterus. So if at all you are suffering from endometriosis, there is no need to remove the uterus, unless of course if the condition of endometriosis is worsened by other kinds of diseases of uterus like fibroids, adenomyosis or uterine malignancies, then you may have to consider hysterectomy. If endometriosis is left untreated, what will happen? Well, we must understand that endometriosis is a progressive condition. So if it is left untreated, the symptoms may progress eventually. For example, if initially you were only suffering from pain during menstrual periods, then gradually you will see that the pain would start occurring even outside menstrual period. At times during particular times of months, but later on it may proceed to a chronic pelvic pain and chronic backache. Even pain during sexual intercourse, urination or defecation. If this happens, this will prompt us to take treatment if we hadn't done anything before. Now, that being said, we must know that although endometriosis is a progressive condition, in most of the cases, the condition never progresses to a point where we need to take a drastic measure. You see, such cases are usually a quality of life issue. If your complaints do not impact your quality of life adversely, then we may not even need to do anything. Also, you must understand that in some ladies, the pain threshold, there's something called as pain threshold. When the lady suffers from the same kind of pain over and over and over again, the pain threshold goes on increasing. You see, the intensity of pain that you can handle is not equals to the intensity of pain that I can handle. That's the same with anyone. So, sometimes in ladies the pain threshold increases. In such a scenario, the quality of life can be maintained. In such scenarios, we do not need to take drastic measures. Otherwise, we may need to reconsider our treatment options. So what are the treatment methods available? Allopathic medications usually resort to hormonal treatment of this condition. As far as surgical intervention goes, we have excisional surgery where we actually excise or remove that particular tissue from that area. But the situation may recur and surgery is kind of the last option, just as we have discussed. This situation never progresses to that point anyway. Now, homeopathic treatment. In homeopathy, we have got plenty of medicines which can not only help relieve the symptoms but also stop the lesion from spreading. Homeopathic treatment can cure the symptoms completely. Some of the homeopathic medicines that we use for such cases are Simicifuga or Actia rasmosa. Then we have Natmur, Xanthoxylum, Belladonna, Pulsatilla, Bryonia, a set of tautopathic medicines, so on and so forth. In homeopathy, we have got a lot of medicines that can aid you in not only relieving the symptoms but also stop the lesion from spreading and thereby giving you a far better quality of life that otherwise you would have if you are suffering from endometriosis. If you have any personal concerns, please WhatsApp us on the number given on the screen. What should you do if you think you have endometriosis? Have a frank dialogue and conversation with your physician. Let us know what you are experiencing and what do you need. My dear lady, it's okay to talk about your problem. For decades, centuries even, women have been told that menstrual cramps are supposed to be normal and all you can do is suck it up and suffer in silence. But that's not the reality. The reality is you must not be laying on the floor griping with pain during your menstrual periods. You must not be crying in pain during sex. Urination, defecation, having sex, these are all physiological processes and mustn't be so painful. Yeah, it's right that menstrual cramps do exist. But if those pains are so severe and unbearable to the extent that you cannot reasonably carry out your daily normal routine, then there's a problem. Talk to your family, talk to your friends, talk to your physician. Let us know what's going on. If you're experiencing it, speak up because we are here to help and together we can make an impact. An impact not only in your life but also in the life of other girls who are suffering, because being informed is what makes all the difference. Feel free to contact me for your personal concerns on the number given on the screen. You can WhatsApp me or even call me. Hope you found the video helpful. Give it a like, share it with the special women in your life who need to hear this. And subscribe to the channel if you haven't already. And click on the bell icon so you get latest updates. Thank you for watching. Be informed, be empowered. Have a happy periods.